52-year-old adventure racer Louise Cooper was concerned after she had found a lump in her breast while training for an event in South America 7 years ago. Louise had a biopsy done, and to her amazement, it was breast cancer.
I was healthy, I was athletic, I had a good diet, I did everything I was supposed to do, and here I was diagnosed with this very aggressive form of cancer.
There's no question that when a woman is diagnosed with breast cancer, her first fear is, I'm going to die. What's going to happen to my children? What's going to happen to my partners, my family, without me?
Breast cancer is the most common cancer and most feared cancer in women around the world. But while more cases are being diagnosed, more women are surviving.
Your first reaction when somebody tells you is, I think you're kind of numb. It takes a while to process it.
Louise underwent a lumpectomy, the removal of the tumor itself and a thin layer of normal tissue around it. But before beginning chemotherapy, she got another surprise.
I think it was after my surgery when they told me that I was HER2 positive, which I had no idea what that meant.
From our research, we found that there's one particular subtype of breast cancer that has an alteration in a gene called HER2, HER2. This occurs in about 25% of the women with breast cancer. It's a genetic alteration, but it's not inherited. It's something that's acquired during the life of the individual. If the breast cancer has this alteration, it behaves much more aggressively. It recurs more rapidly and earlier. It forms metastasis much more readily and more widespread.
Louise Cooper signed on to receive a new targeted treatment specifically for HER2-positive tumors.
The visual that I had was this drug being injected into my body, and it was blanketing the cancer cells and blanketing those receptors, and it was thereby going to prevent any further production of the cancer cells. So just that vision was helpful to me.
Louise also received chemotherapy.
We are able to administer chemotherapy with far fewer side effects because in parallel with the development of new and effective anti-cancer drugs, we have also developed new and effective drugs that prevent or control side effects. So nausea and vomiting, for instance, are much less common and much less severe today.
Along with the advances in chemotherapy, modern-day radiation techniques do a better job of treating the area at risk of recurrence and avoiding or minimizing the dose to normal tissue. Research has proven that anti-hormone medications can reduce the risk of the cancer returning and also may reduce the likelihood that cancer will appear in the other breast.
The major idea behind hormonal therapy is that female hormones, in this case estrogens, are the fuel that helps breast cancer cells to grow and spread. And hormonal therapy is interfering with that fuel.
Experts believe that as women understand the progress that's been made in breast cancer, the pervasive fear of the disease will begin to diminish.
Our goal is to get rid of the cancer or manage the cancer so that she can never see it again, or at least push it aside and keep living her life in a way that she wants to.
My mother and my father, who were always opposed to the kind of events that I was involved in. My parents are now, so when's your next race? They can't support me enough because to them it symbolizes that I'm healthy and I can do it.